Hello, your doctor has you watching this video because you were recently in the hospital or are currently in the hospital and found to have a problem with your heart called heart failure. While the term heart failure may sound very scary, the goal is that after watching this video, you will know what heart failure is and learn how to care for yourself and keep your heart healthy. In this video, we will discuss what heart failure is, what causes heart failure, how people feel when they have heart failure, and how you can take good care of yourself to prevent having to be in the hospital again. So what is heart failure? Heart failure occurs when the heart is unable to pump out enough blood from the heart. The heart is unable to pump enough blood to meet the oxygen demands of the body. The heart tries to overcome this by other means, such as beating faster or growing larger, but ultimately these are just temporary measures that mask the underlying problem which needs to be addressed. Unfortunately, there is no known cure for heart failure. However, you can still live a very full life with taking good care of your body by taking your medications as prescribed by your doctor and living a healthy lifestyle, which we'll review in this video. So who gets heart failure? Heart failure is actually quite common, so don't feel alone. About 1 in 4 people will develop heart failure in their lifetime. People that are over the age of 60 have a much higher chance of having a diagnosis of heart failure than those under age 60. Additionally, individuals who identify as Black or African American as their race or ethnicity are the most at risk compared to other races and ethnicities. There are many different causes of heart failure. Things that can put you at risk for developing heart failure include high blood pressure, being overweight, using tobacco, alcohol, or other drugs, and other conditions such as diabetes. Many of these things can be prevented through a healthy lifestyle. Some people have heart failure for a reason that is not caused by lifestyle, such as genetics or something that's been passed to them from their family members. So how do you feel? What does it look like to have heart failure? Most commonly, people can experience fatigue, which means having lack of energy or feeling more tired than normal. Patients may require more rest to do the activities that they used to be able to do. You may also feel short of breath or difficulty breathing, particularly when you're walking, going up and down stairs, or even when you're lying down. You may also experience swelling or enlargement of your legs and abdomen. So what can you do to help with these symptoms and help you feel better? The best thing that you can do is taking very good care of yourself and monitoring your symptoms. Do everything that your doctor has instructed you to do and follow up with them closely if you have any questions. In terms of how to change your lifestyle, the most important thing you will now need to pay attention to is how much sodium or salt that you are consuming in your diet. The goal is that you want to consume 2 grams or 2,000 milligrams or less per day of salt. When you eat salt, this also encourages your body to hold on to extra fluid, which your heart is having a hard time pumping and dealing with right now. So by limiting the salt, you can help limit your symptoms and help yourself feel better. Foods that have high sodium content include foods that are canned, processed, fried foods, deli meats, sports and electrolyte drinks, and chips, crackers, other snack foods. Preparing as much of your foods at home as possible will help you to limit the sodium in your diet. You should also be avoiding tobacco, alcohol, and other drugs. If you do need to take any medications that are over the counter, always talk with your doctor first, as some over the counter medications are not going to be safe for people with heart failure. Your doctor will also likely prescribe you several different medications. It is very important that you understand when and how to take your medications. You should take these as prescribed by your doctor, so if you have questions about how, when, or why that you're even taking these medications, please be sure that you follow up with your doctor. You should also be monitoring your symptoms or how you're feeling at home. If you have any change in your symptoms, such as you're having more shortness of breath, you're more tired than normal, you have more swelling, or your legs or abdomen are increasing in size, let your doctor know right away. Oftentimes, your doctor can make changes to your medications after you speak with them that can address your symptoms or how you're feeling before you need to come back to the hospital and can prevent you having to stay overnight in the hospital. Be sure that you attend all of your appointments as asked by your doctor, as they will make important adjustments to your medications, may get blood work or other tests such as pictures of your heart to monitor how you are doing. So in conclusion, we reviewed what heart failure is and what you can do to take care of yourself with the goal of keeping yourself out of the hospital and living a great life. Please follow up with your doctor if you have any further questions that you may have about your heart. Thank you.